Good day. My name is Zi-Han Geng, a surgeon from Zhongshan Hospital, Fudan University in Shanghai, China. I'm really delighted to have the opportunity to introduce the article Muscular Injury as an Independent Risk Factor for Esophageal Stenosis after Endoscopic Submucosal Dissection of Esophageal Squamous Cell Cancer here. Today, I will discuss three aspects. First, why did I feel a need to do the study? Esophageal cancer is usually not detected early, leading to a poor prognosis. Emerging optical imaging techniques, such as narrowband imaging endoscopy, have facilitated the early detection of precancerous lesions and esophageal cancer. Endoscopic submucosal dissection (ESD) has also become an effective therapeutic option, enabling en-bloc resection, facilitating precise histologic assessment, and reducing recurrence risk. The long-term efficacy of ESD is close to surgery for selected patients, but with less trauma, fewer complications, and no reported mortality. However, in the esophagus, ESD can lead to esophageal stenosis, especially when more than 3/4 of the esophageal mucosal circumference is resected. Endoscopists often assess patients at high risk of esophageal stenosis based on the circumferential range and infiltration depth of lesions, and interone with steroid hormones or stents in the early stage. Other risk factors, such as muscular injury, are also related to esophageal stenosis caused by ESD. After muscular injury, inflammatory reactions occur in the wound, and eventually scar formation leads to postoperative stenosis. However, muscular injury during the operation is usually ignored. Herein, we conducted a retrospective study of patients with esophageal mucosal lesions who underwent ESD at our center. We evaluated the association between muscular injuries degrees and stenosis and proposed a new classification system to evaluate the severity of muscular injuries. Second, what does our study add to existing knowledge? Muscular injuries are less studied for esophageal stenosis compared to other factors. They are easily ignored and might be a key factor for esophageal stenosis. Here, we classified muscular injuries into types 1 and 2 based on their repair difficulty and muscular fracture condition. We analyzed 1,033 cases and found that patients with type 2 muscular injuries easily developed the stenosis, especially complex stenosis. Therefore, intraoperative muscular injury should receive more attention from endoscopists. Furthermore, we established a scoring system for muscular injury after ESD to allow early interventions and reduce occurrence of esophageal stenosis. We established and validated a novel, simple-to-use scoring system to evaluate muscular injury occurrence with an AUC of 0.706 and good discrimination, and it can help endoscopists evaluate muscular injury risk in patients. This scoring system has three factors: circumferential range, infiltration depth, and submucosal fibrosis. Patients with scores more than 3 have a high risk of muscular injury during the endoscopic surgery and should receive more attention. Our scoring system has several advantages. First, it was based on clinical characteristics that are easily obtained, facilitating its application in clinical settings and might help predict muscular injury. Moreover, a relatively large number of patients were included, providing adequate power for multiple risk factor analysis. Additionally, we applied tenfold cross-validation to tune model parameters, leading to a discriminatory scoring system. This system could categorize patients into different groups and determine the muscular injury risk for each case to achieve early prevention and reduce the risk of esophageal stenosis. Third, what should come next? Our study also has some limitations. First, we only performed internal validation to assess our scoring system. Cases from external sources should be further used to improve the generalizability of the system. Second, this was a retrospective study with potential bias, hence prospective studies should be conducted in the future. That's all. Thank you very much.